Welcome, and thank you for joining us today at this benefit comparison presentation. My name is Pat Salas, and I'm the president of SBIS, South Bay Health and Insurance Services. We are an insurance agency that specializes in helping people with Medicare find the plan that best suits their needs. We do this by helping you compare the benefits and allowing you to understand them, choose the one that makes the most sense and fits your pocket the best. Today, I will cover a number of disclosures that the Centers for Medicare and Medicaid Services want you to know about. And those are the ones I will be talking about in the next few minutes. To begin, we would like you to know that SBIS and all of our agents are contracted with every plan that will be covered today. The agent will explain which companies he will talk about and what plans he will cover prior to beginning his presentation. The services SBIS provides and our agents are free of cost to you. How we get paid and how we are compensated is by the health plans. Anytime we write an enrollment, the health plans that we are contracted with pay us for those enrollments. It's important you understand that SBIS is an independent agency, and our agents are independent also. That means we do not work for the Centers for Medicare and Medicaid Services, Social Security, or your physician's office. We do have a relationship with all of the health plans that we will cover today. And because of that relationship, we can present them to you and help you enroll into them. The plans you will be shown today renew their benefits and contracts with CMS every year. That's why it is so important for you to attend a presentation such as this one on a yearly basis. You want to make sure that your benefits have not changed, and if they have, that the plan you have continues to be the one that makes the most sense for you. Now I will show you how the different enrollment periods work, what they mean, and why it's so important for you to understand them. Please take note. Let's talk about when you can join a plan. October 15th through December 7th is annual enrollment period, also known as AEP. During this time, you can enroll into a standalone prescription drug plan. You can join a Medicare Advantage plan that includes drugs in it, or you can change from one prescription drug plan to another, or from one Medicare Advantage plan to another. The changes you make will become effective January 1 of 2013. January 1st through February the 14th mark the dates for the annual disenrollment period, also known as ADP. Members that are already part of a Medicare Advantage plan may choose to leave their plan and return to original Medicare fee-for-service. During this period, you may also add a standalone prescription drug plan. Please remember, you will not be able to switch from one Medicare Advantage plan to another during this period. You will only be allowed to add a standalone prescription drug plan to your original Medicare. February 15th through October the 14th mark the dates for the lock-in period. During this period, you are generally not allowed to make any changes. The only time you're allowed to make changes during the lock-in period is if you qualify for what's called a special election period, and in order to qualify, you must meet special circumstances. Some of these include you moved from one county to another, you qualified or lost eligibility for Medicaid, as well as many others. Please consult with your agent as to what events may qualify you for a special election period. In order to qualify for a Medicare Advantage plan today, you will need to meet the following qualifications. 1. You will need to have Medicare Part A and B active. 2. You cannot have end-stage renal disease or ESRD. This is dialysis. And 3. You must live in an approved zip code. We will give those to you later. In addition to the Medicare Advantage comparison, in some instances, we will also cover special need plans. These plans break into two categories, one for people who have chronic illnesses and qualify for these particular plans, and the other for people with low income. If you are in one of the counties where we offer these benefits, these plans will also be explained today. Now that you know whether or not you qualify for a Medicare Advantage plan, it's important that you understand how these Medicare HMO plans work. When you choose one, you must also choose a primary care physician. That doctor is in many instances known as the gatekeeper. He will belong to a medical group which you will choose when you enroll into the plan, and that doctor will send you to a specialist within his network. But remember, they're not self-referrals. When you go to the specialist, the primary care physician must refer you out. Your primary care physician will not only refer you out to the specialist, but he will also contact your medical group in order to get authorizations for particular exams, tests, and other things that you might need. Original Medicare does not cover most prescribed drugs. However, all of the plans that you will hear about today do. We will show you a slide that will clearly explain how prescription drug coverage works. The Medicare coverage gap or donut hole begins once you reach your Medicare Part D plan's initial coverage limit. The Medicare initial coverage limit is $2,970 in 2013, and it ends when you spend a total of $4,750. In the gap, you will no longer have additional prescription coverage in most cases unless the plan says they will give it to you. Once you reach $4,750 in utilization during the gap, you will move into what's known as catastrophic coverage. In catastrophic coverage, you will pay one of the following, whichever is greater: 5% of the cost of the medication or $2.65. It's very important that at this point, our agent shows you a sample of a formulary. The formulary is the official list of approved medications that the plan you choose will cover for you. It's important that you have a copy of it handy so that you know what copay level and at what tier your prescriptions will fall. It's important that you know how to find your formulary if you don't have a copy of it handy when you're at home. Please understand that you can find those drugs listed on Medicare.gov under Plan Finder. You can also find them on the website of the health plan you choose, and you can find a hard copy by calling member services of the plan and requesting one to be sent to your home. Part D is prescription drug coverage. It is not mandatory, yet all of the plans you will be presented with today already have it. If you're someone who became Medicare eligible and you did not choose a Medicare Part D plan to go alongside your Medicare, you might be responsible for penalties up to 1% per month of the national premium average for not having had Part D coverage. Your agent can give you more assistance and information on this later on. We're going through some difficult times in our economy today, and that might be the case for you at home. If so, we will show you ways of getting additional assistance if necessary. There is extra help available. If you qualify for this help, it might help with paying for your drug's plan monthly premium, your deductible, co-insurance, and co-pays for your prescription drugs that are on your plan's list of covered drugs. It can also help you with no coverage gap, and it can help you if you missed your late enrollment periods. You already qualify for additional help if you have one of these: both Medicare and Medi-Cal, help from Medi-Cal paying for your Part B plan, both Medicare and supplemental security income. If you do not have one of these, you may still qualify for extra help by applying for low-income subsidy. If you want to know if you qualify for extra help, you may reach one of the following: 1-800-MEDICARE. TTY users, please call 1-877-486-2048, 24 hours a day, 7 days a week. You may also call the Social Security office at 1-800-772-1213. TTY users, 1-800-325-0778, 7 a.m. to 7 p.m. Monday through Friday. If you want further information, you may also contact your local state Medicaid office. Furthermore, you can talk about these options with your local agent. Our agents are very well trained in the options and can further assist you. As a Medicare beneficiary, you have certain rights when you join a Medicare Advantage plan. When you do so, you have the right to file an appeal or a grievance. Appeals have to do with financials. If you get a bill and you're charged an amount that you do not agree with, this would be an appeal. You would file it with the plan. If you have a grievance, this would have to do with a quality of service or something that happened that you were dissatisfied with. Once again, you can call your plan and file those. If you wish, you could also call Medicare directly and do it with them. You may file your appeals and grievances directly with the plan by calling their customer service line, by mailing them a letter. You may call the Centers for Medicare and Medicaid Services, and you can also call your agent who can help you process one. Once you complete your enrollment application for the plan of your choice, it will be submitted to the plan. Once the plan gets it and submits it to CMS, it will be approved or disapproved. Once it is approved, you will receive a letter welcoming you to the plan. Right after, you will receive a new member welcome kit as well as a new membership ID card. You will be using this ID card in lieu of your Medicare card when you receive medical services with your primary care provider and the specialist he refers you to. Once you are enrolled into the plan and you're an active member, if you decide that you no longer want to be in that plan, you may disenroll from the plan. In order to do so, you must say so in writing and send this into the health plan, or you can call 1-800-MEDICARE and request that that be done for you. It is important you understand that if you do that, you will be returned to Medicare fee-for-service only with no additional coverage. I am now going to pass the presentation on to your agent. He or she will let you know what those wonderful benefits you came to learn about are. Thank you so much for coming. I wish all of you the very best and much health.